Human Services continues to shift from the public to the private sector in our nation. Many states have privatized significant components of their safety net programs, including child welfare, mental health, and developmental disabilities, to name a few. And to discuss more, we are joined by William Waldman. And thank you so much for joining us here today.
Thank you. It's a pleasure to be with you.
Well, let's talk about some of the different places where we have seen this privatization. We were talking earlier, we've seen nursing homes, we've seen prisons. When is it a good idea to privatize?
I think in each instance, an individual decision needs to be made. And one of the thoughts is, what is the core competency of government? What do we do best in the public sector? And what can the private market deliver for us more effectively, more efficiently, at a lower tax burden to our citizens?
Let's talk a little bit about your experience and what you're advising and what you recommend.
Okay. My own experience, I once served as Commissioner of Human Services for the state of New Jersey, and I led significant efforts to shift from the public sector to the private sector, the operation of many services. For example, I closed a number of very large state institutions for the mentally ill and the developmentally disabled, and shifted the responsibility for the care of those individuals to private organizations and closed the large facilities.
Well, now I'm going to take one of those nursing home.
Sure.
And they here in the States, and large nursing home, but there was so many protests because the nurses themselves, some of the folks in the healthcare business, didn't want it to be privatized. Why are we seeing that divide?
Well, one thing, there's a lot of jobs at stake. Certainly unions are active, public sector unions are active opponents to it. People fear that the motivation for private companies may be just financial, not necessarily quality care. And also there's the concern about how the most vulnerable, most needy, the most expensive to care for, going to be served in a private sector setting.
So when should we privatize? That's a big question, I know that.
It's always a big one, and it's always individualized. I think if we follow certain procedures, one is we got to determine, is there a private market out there that's delivered this product or service effectively? What kind of cost controls can we put in to make sure that the taxpayers' dollars are well spent and that the most vulnerable are cared for? And we ought to figure out the cost very carefully. One of the lessons learned, I guess, from this is that when you privatize something, the formerly public employees delivering the service often go on welfare or public assistance or unemployment. So you need to factor in those costs as well, too. Also, you need to put in a good contract to make sure that the public sector gets what it pays for.
Well, again, in the something that I covered pretty extensively was the nursing homes, where they were losing millions of dollars for certain states. But when you privatize, there's actually a formula where they can start making actually money. So is this a good reason? Is it a financial reason to privatize?
It may be a financial reason. Sometimes in the public sector, surprisingly, the tides have turned, where public employees are compensated better and get better fringe benefits. So sometimes the government's much more expensive to operate particular healthcare facilities in the public sector. On the other hand, opponents of this would say, well, the private sector will pay less, require less credentials, possibly, of individuals being served. So I don't think there's anything inherently wrong with privatization. The question is how you do it, which service you provide, and how you protect the public from excess profiteering and protect the most needy or vulnerable citizens.
So I guess the next question would be, how do you do something like this? This is a pretty big undertaking.
It surely is. I think that first off, you have to define what it is you want to secure, what type of services in great detail, because if you don't specify it, you're not going to get it. Two, you got to specify what are the standards, what are the deliverable products you want to get from there. So there's some level of accountability and enforcement. You also need a workforce that's very competent and knows how to do business, in essence, and monitor private sector corporations to make sure they're delivering the services that we need. So in every one of these instances, I think if you make the initial determination and then you follow through with sensible business procedures, in some cases it can be very effective.
Well, with your wealth of experience, is there any one industry that you would say needs to be privatized almost immediately?
Well, for example, food service in institutions that I used to run. There's no reason why we need to operate food service as a government. There's an established private sector out there. When I was in government, we ran 22 child care centers, and we realized there was a vibrant private sector out there running child care, and government didn't have to do that. I think in every government and every sector, it's an individual call based on criteria and experience and capacity.
Well, we thank you so much for joining us. William Waldman, we certainly hope you come back to Ebru today, and thank you for sharing your insights.
It's my pleasure. Delight to be here. Thank you.